computer screen or poring over documents and diagrams. Maybe as you get older, you struggle later in the day to focus on your favorite book. Whatever the reason that you find your eyes tired and that you struggle with eye fatigue, it's time to try Fortifeye Focus. Fortifeye Focus contains the powerful ingredient astaxanthin, a natural supplement discussed time and again among those in the eye care community as a powerful solution for fatigue due to eye strain and blue light exposure. Natural astaxanthin, the key ingredient in Fortifeye Focus, works at the mitochondrial level to support.
Hey, I'm Dr. Michael Lange. We want to age as gracefully as possible, don't we? So is there enough evidence out there that proves that certain specific nutrients, ingredients, or supplements can enhance, our skin, our joints, our hair, our nails? And there's a lot of great science that's come out recently with marine collagen tripeptides, rice ceramides, hyaluronic acid, and there's a new supplement called Dermaval. Well, we've taken all four of those and we've combined it in a supplement called Rejuvenate. 3 delicious flavors, chocolate, cherry vanilla, pink lemonade, and then we have it unflavored for those of you that want to just put it in your coffee in the morning. It's worth a try. I endorse it, obviously, 100%. If you don't like it, we'll give you money back. It's as simple as that. So check it out at Fortifeye.com.
Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lange.
Good morning and welcome to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision and eye care. So take advantage of the show. Give me a call, or I should say give us a call. So I've been hosting Ask the Doctor since April of 1993, nonstop. As a matter of fact, it's the longest running medically hosted live doctor talk show in the country right now. So it's been pretty quick, actually. Time flies when you're having fun. But this morning, and as usual, it's Ask the Doctor. So it's Dr. Michael Lange. My co-host is Dr. Susan Summerton, who is also hailing from the Lange Eye Institute and Fortifeye Vitamins. And I'm going to like to tell her good morning. Good morning, Dr. Summerton. How are you?
Good morning, Dr. Lang, and good morning to all our listeners out there. I'm calling in from the Villages, Florida. It's a beautiful day here, and we're excited to bring what we have new technology in our office, and also here to answer calls and any questions that come up. We're happy to help.
That's right. So remember, we're coast to coast. So we're live video streaming all over the world. So it's actually good morning, good afternoon, or good evening, just depending on what part of the planet you're watching or listening to us from. So this is a number you can call if you've got a question regarding your vision, an eye care question, a nutritionally related topic. Remember, we're not only board certified optometric physicians, we're also certified nutritional specialists. So the phone number, write this down, live call-in show. Consultation is free. Remember, this never replaces a medical evaluation or an eye examination. This is for educational purposes only. And the number is 813-282-8283. That is 813-282-8283. One more time, 813-282-8283. That's the live call-in number. And we're, like I said, coast to coast, a multitude of stations from California to Florida up to New York, Pennsylvania, and everywhere in between. And we like to talk about nutritional wellness, all right? How it affects the body and the eyes. Remember, if we make your eyes healthier, we make your body healthier and vice versa. So we talk about a lot of things on this program to help slow down the proverbial aging in the body. We all want to look better and we all want to feel better. So I'm just going to start off with a few quick little outline tidbits, nutritional hacks that can help you gain these goals. So sleep. Most of us don't sleep well, and I'm one of them. You know, I'm probably sleep deprived more than anybody. I got so much on my mind, I don't sleep much. But usually Saturday nights I do sleep because I don't have to get up early Sunday morning. That's the day of rest, right? So sleep is very, very important for anti-aging. Weight management, we talk about this all the time. Weight management is crucial. If you're overweight, you got to get down to your ideal body weight. Sometimes it's easier said than done, as you know. We are working on a new supplement called Fit Meal, Fortifeye Fit Meal. We have the third prototype we're going to sample on Monday, and Dr. Summert has been involved in this with me. And it's going to be a complete meal replacement that has fat burners and very little carbohydrates, very low calories, lots of protein, lots of fiber, interesting soluble fibers. And we even have some GLP-1 agonists in it, things like allulose. Dr. Summerton, we've been pretty amazed with allulose, haven't we? It's a simple, rare sugar that we're starting to incorporate in some of our daily lives now.
It is. We've finally found a sugar that is actually good for you and also very good for diabetics too. I know diabetics especially struggle because they know they're supposed to stay off the sugars, and there's all the artificial sweeteners out there, all kinds of variations that we think are good for us and are not good for us. But the allulose is actually from like figs, dates, and raisins, and they've found that this sugar does not have that glucose response that the rest of the sugars do. And it also doesn't kind of fake your body into thinking you're getting sugar. But what it does, it's almost like a natural GLP receptor to end up making you feel fuller without having the high sugar response, but you still get that nice sweetness. It's not a super sweet sugar, not overly sweet, but it's just enough for those that like to sweeten things. It's a great additive that's healthy for you.
Right. So allulose is going to be one of the sweeteners that are actually in the new Fortifeye Fit Meal. And remember, it's going to act as a GLP-1 receptor agonist. It's going to help you lose weight, which is going to be our goal. But if you're already skinny, it's not going to make you lose more weight. Actually, it's going to have a lot of protein that'll help you build muscle too. So that's important. Weight management, proper diet is important. Look at the Lange survival diet online. Lange survival diet, drinking plenty of fluids. Hydration is crucial. Getting exercise. So not only cardiovascular exercise, but some sort of resistance training, weight training, very important. New study came out showing that weight training can reduce the chance of you getting Alzheimer's, dementia. So exercise is very important. And then proper supplementation. And that's where Fortifeye Vitamin comes in. Fully transparent vitamin company. We search out for the best areas in the world to get our ingredients. So fortifeye.com. Check that out. Fortifeye.com. All right, we're going to go to the phones. Let's go to the first caller. I think it's Kevin in Anthony, Florida. Kevin, good morning. Thanks for holding.
Yes, good morning, Dr. Lange. Dr. Lange, I just want to tell you that I believe I've been listening to you almost from the beginning in the early 90s on WOCA here in Ocala.
Right.
And I don't know. I love listening to you. I don't catch your whole show, but I love listening to you. And I have an appointment to come see you on May the 12th and get a regular eye exam, which I've never had in my life. I'm 67 years old. But my question for you, Dr. Lange, is my wife had what I would call is a sty on the inside of her bottom eyelid. It's like a little pimply thing. Is there anything we can do for that? She's actually going to go to a walk-in clinic today because it hasn't gotten any better in 4, 5, 6 days.
Right. So a sty usually is what we call a hordeolum, an internal or an external hordeolum. It's a little bump on the lower upper eyelid. If it's very red and tender to the touch, we call that a hordeolum. If it's not tender to the touch, it's just a big lump. It's probably a chalazion. So the number one thing for this is actually hot compresses. She could take a hot washcloth or a tea bag or something that retains heat and put it on there literally 4 times a day for 10 minutes. That's going to help. Oftentimes we prescribe a topical antibiotic, anti-inflammatory drop or ointment. And depending on how potentially infected it is and how hot it is, maybe even oral antibiotics are important for this. And then also, taking something like a good triglyceride molecule omega-3 fish oil, like our Fortifeye Super Omega, can help reduce the chances of her getting a sty again, because it keeps the fluid in the meibomian glands that get clogged much thinner, and once again, decreasing the chance of this becoming an infected, impacted type of sty. And then we also have a new treatment, and we are the only ones in the Villages, Ocala, Leesburg area that has the Lumenis Opti LIght. And the Lumenis Opti LIght, as a matter of fact, I'm doing a few sties on Monday, a few procedures with it. It's basically like a magic wand that has a frequency of light, intense pulse light. Some people think it's a laser, but it's not. And we actually touch that sty with that a few times in certain areas. And that's a non-surgical way of helping it to go away. And Dr. Summerton has done a few of these already with the new Opti LIght. Why don't you chime in on that?
It is, because some of these styes are down deeper in the lid, and we want to do that heat to expand those blood vessels. So not a whole lot of blood vessels in the lid, and the blood vessels are going to help carry the antibiotic to it, but also help carry the trapped cells away from it. So if we can penetrate that lid with this intense pulse light of these stronger wavelengths and add the heat to it, we can break it up, help the whole healing process naturally without having to have it spread into a further infection, and also prevent it from, like you said, becoming a chalazion that before now we just had to send the surgeon to have it cut out, which ends up leaving a scar. So it's a great, another natural alternative that is very quick in the healing process.
So if she's in a lot of pain and it's really swollen, and then it's probably a good idea to get seen, today. But you can always try the hot compresses if it's not that bad.
Yes.
And sometimes it goes down relatively quickly with just the hot compresses.
Yes. Okay. Yeah, I did look it up, and that's what I did kind of recommend. But I don't really know. I'm not a doctor, but I remember them happening years ago. My dad had a sty, and they're painful, but it is painful to her, and it's uncomfortable. It's been a while. So you think she could make an appointment to come see you guys, or what do you think about that?
I mean, absolutely. Either one of us would be happy to see her first thing Monday morning, as long as it's not too bad. And instead of going to the urgent care center, if you were going to see somebody today, I would go to a local eye doctor that's open on a Saturday. And a lot of the commercial chains, have optometrists in there that can treat this without a problem.
Okay. Sounds great, Dr. Lang. And I also take your Focus and Brain every day and the Super Omega. Those are the two products I've been taking for quite a while that I try not to miss. But she has not been taking the Super Omega, and she's been asking me about it. And I said, yeah, let's but I'm a firm believer in those two for sure. But I thank you guys for everything, and I'll see you, Dr. Lang, on May the 12th.
All right, Kevin. I look forward to seeing you.
Have a great day. Thank
Bye-bye.
you, folks. Bye-bye.
All right, you're listening to Ask the Doctors, Dr. Michael Lang and Dr. Susan Summerton, both of the Lange Eye Institute and Fortifeye Vitamins. If you've got a question regarding your vision or eye care or a nutritionally related topic, pick up the phones and give us a call at 813-282-8283. That is 813-282-8283. So talking a little bit about, looking better and feeling better, all right? Is a pretty easy, or a nutritional supplement, I should say, that works amazingly well at helping you build muscle and lose fat at the same time. Both Dr. Summerton and myself take it. My 97-year-old mom takes it, and it's called Fortifeye Fit Pro, okay? And you guys should go to the website at fortifeye.com, go to the performance nutrition section, click on Fit Pro, and just read the science behind this. All right. So we've talked about creatine on this program a lot, and creatine is one of the most studied nutrients out there. It has over 700 clinical studies. It's good for the muscles, the bones. It's good for depression. It's good for, cognitive abilities. It's good at decreasing the chance of getting concussions if you get in an accident. So creatine is great for building muscle and endurance and strength. But there's something else that is also in the Fit Pro that works as good, if not better, than creatine. And when you combine it with creatine, it's the double whammy of fighting against muscle loss, and it's called HMB. Now, this is pretty impressive stuff, so listen up. HMB is a pure form of a metabolite of leucine. And you've heard us talk about leucine. That's one of the branched chain amino acids. And the studies out there that show that if you take this HMB, and the best HMB is called MyHMB, 57% less muscle protein breakdown, all right? But check this out, 250% increase in lean muscle mass versus training alone. So if you're going to the gym, and all of you should be doing some form of training, doesn't have to be in the gym, 250% greater increase in lean muscle mass. Now check this one out, 210% increase in fat loss. So we're building muscle and losing fat. That's the ideal situation. 200% increase in quadricep thickness. That's your leg muscles. 54% increase in anaerobic power. 58% increase in vertical jump. I had my daughter, Mackenzie, who is literally a world-class volleyball player. And one reason she was so good, I'd like to think, is the Fit Pro. She was on it since the conception. So Fit Pro has this MyHMB. It has the creatine. It has grass-fed whey protein, grass-fed collagen protein, L-citraline, peak ATP for energy, Betaine anhydrous, and a few other things that make it work synergistically together. And let me tell you, I'd like to have my New Orleans accent to come out. I guarantee that if you are on this for 1 month straight and you're in the gym, you will improve strength, muscle size, and you'll lose body fat. I guarantee. And if it doesn't work, if you're not happy, I'm all about giving you money back. I don't want to stick anybody with anything if it doesn't work. We'll legitimately create supplements that have evidence-based science behind them. And that's one reason Dr. Summerton's on the team, because she's an expert in the whole nutritional arena. She has more initials behind her name than any doctor I know in the nutritional arena. And we like to, Dr. Summerton, we really try to practice what we preach. I think you were doing some sort of new training this morning, weren't you?
I did, and that's the first thing I did when I got up this morning. I got up and I had made my Fit Pro. This morning I had pina colada, and I mixed it with water. I even do just room temperature water. So I'm also getting that hydration right when I first wake up, because we all wake up a little dehydrated as well. And then I went off to a little challenge, a little dry try, where we did about 900 meters on the rower, and then we did 300 repetitions of different weight exercises, and then we did 1 mile on the treadmill. And that was really intense as far as keeping your heart rate up the whole time. And we needed that having that Fit Pro in my system, that really helped take me through it. And then when I'm done, I actually just finished, I had the vegan protein. I like the mocha one in the morning. And then I added a little bit of honey to get my carbohydrate back in. And I'm feeling pretty good right now.
That's right. Carbohydrates are very important. All of you listening that are in ketosis all the time on a strict carnivore diet, let me tell you, I always say this, do you want to thrive or just survive? And a little bit of honey or even some blueberries, some form of carbohydrate right after you're working out is very important for muscle recovery. You got to have carbohydrates to replenish muscle glycogen. You can survive on a ketogenic diet and on a carnivore diet. But like I said, do you want to survive or just thrive? So check out the Performance Stacking Bundle at Fortifeye.com. It's called Performance Stacking Bundle because that has both the Fit Pro and your choice of the whey proteins. Performance Stacking Bundle is dramatically discounted, and you can check out at Fortifeye.com. That's Fortifeye, Fortifeye.com. Also, before we take the next caller, I do want to say that we are going to briefly talk about a few things here in a minute. Things that we used to think were good for us, all right? Things we used to think were good for us, now we're finding probably are not so good for us. And we'll expand on those in a minute, but things like long-term ketogenic diets, okay? Being in ketosis long time, not good, and we'll tell you why. Long-term fasting, not good, we'll tell you why. Cold plunges. Everybody's very vogue now doing these ice cold plunges, and it might not be the best thing for you either. And we're going to talk about that in just a minute. Also, I want to mention that the new grass-fed whey isolate is in. It came in last week. It's in a clear bottle. It's 30 servings. It's not in the 60-serving bag anymore. We put it in a 30-serving container, so it's in. So hallelujah on that. Wow, we had some balloons going up. That's kind of cool. That was on Instagram. And that whey isolate is in. The Fortifeye eye pressure and neurocognitive support is in. We were on back order for that for a little while because a lot of doctors that are treating glaucoma are recommending this to their patients all over the country. So Fortifeye eye pressure and neurocognitive support is in. The new expansion on the Lange Eye Institute is complete. And now you come in, if you want to see Dr. Lange, you turn right when you come in the Lange Eye Institute. If you want to see Dr. Summerton, you turn left. We purchased a lot of new state-of-the-art of the equipment for the Lange Eye Institute. It is all in on both sides of our Lange Eye Institute. And we're also going to expand a little bit on the Opti Light and Opti Lift in a few minutes. But let's go to the phones. We're getting loaded up. I think Janice is first, and then we'll go to Steve. Janice, good morning. Thanks for holding. No, Jackie.
Jackie, hi.
Jackie. How are you?
I'm good, thank you.
What can I do for you?
Well, I just wanted to talk about, I have severe dry eye. I'm in New Jersey now, but we're coming down to the villages. We may have an appointment with you. And I wanted to say all the stuff that I'm taking. And the Xiidra I have been on for years, and I hate it. And there doesn't seem to be anything else. I was wondering if you had any suggestions what to do for the dry eye.
Okay, so a lot of people don't like that particular drop. Some people say it tastes bad and it stings, and does it work as good as they want is the question. Sometimes it's relatively priced kind of high as well. So, we are definitely dry eye experts, and we try to do things as naturally as possible for dry eye. And, I like either Oasis Tears.
Naturopathy, so we're both naturopaths. People, right. So we do like to do natural things.
Awesome. Then we get along great. So a few things. Lid hygiene is important. Hot compresses, keeping your eyelashes very clean.
Yeah, I have like OcuSoft lid scrub.
Right.
I've even
omega-3 fish oil, or better yet, if you go to our Fortifeye,
Sometimes I'm good, and other times it's just torturous.
if you go to our Fortifeye Advanced Dry Eye Therapy, that's a kit that contains our omega-3, our black currant seed oil, and our Fortifeye Focus all in one. And I've been using this with patients for a long time. We used to do a lot of intracellular blood draws to see the actual lowering of inflammatory markers. So not only does it help the dry eye, it helps people that have, swollen joints, people with arthritic and autoimmune, diseases because of the natural anti-inflammatory properties. And then, we got other things that we can use. I like a drop called Regenerize. It's got amniotic fluid in it. So Regenerize is my favorite go-to drop from a drop for dry eye. It works the best. It's on the Fortifeye website.
Too, yeah.
And then, we also sometimes for dry eye, we'll do punctal occlusion. Those are punctal plugs. It's covered by your insurance. Amniotic membranes on the cornea, kind of like a contact lens.
I've had that too. I'm telling you, I've been around. It just doesn't go away. It's better than it was, but it's.
Well, Jackie, you're coming in and out. I'm going to tell you the latest and greatest for dry eye, and I'll let Dr. Summerton expand on it. She's somewhat of an expert in this. But the latest and the greatest for dry eye, once you've tried everything, and it sounds like you've done just about everything holistically and medically. So the next step is to look into the Opti LIght made by Lumenis. It's the Opti LIght IPL, Intense Pulse Light Therapy. I did 20 procedures yesterday on Friday. Every single patient is benefiting, and most fairly dramatically. This IPL actually opens up the meibomian glands, and I'll let Dr. Summerton expand on it. She's more scientific in this arena than I am, but it does work. Dr. Summerton.
It is. And like you said, it's a safe treatment. And we brought in this treatment because of people like you that we've tried everything on. We've tried all the drops. We've tried the warm compresses. We've done all the nutrients, and people, it's still not quite there. So then we're thinking, how do we get really into the root cause of the problem, but still take a most natural approach that we can? And we know 80% of the reason for dry eye is because of these meibomian glands that release the oil into the tears aren't working properly. So we're able to actually photograph those glands in the lids. And the studies after doing this IPL treatment, 4 treatments we recommend 2 to 4 weeks apart, it actually, you can see how those glands just improve in the structure of them. And then after we're done, we actually will express those glands. And then we can also visibly see the oil that was trapped in there or not even functioning is able to be squeezed out. Then we know when you blink, you're going to get that natural little bit of oil into your tear film to prevent your own tears from evaporating, so that improves the quality of your tear film. It improves the defense of your tear film. It improves the vision because it's more stable. And we just see just remarkable results. Some might not notice it until about the 3rd treatment, but by the 4th treatment, that's when we've got our goal.
Literally, Lumenis Opti Light's like magic. It works quite well. And we finally have something in our arsenal that we can stand behind and we can recommend for all of those patients. We've tried literally everything, and nothing has gotten to the point we want the benefits, the positive benefits. So consider IPL. When you're looking at IPLs, Lumenis Opti Light is the only one that's FDA approved for dry eye treatment. All right, Jackie? All right. I think we lost Jackie. So we're getting ready to take another phone call here in just a second. Anyway, Jackie, hopefully you heard all that. You sounded like you were in the car driving. You probably went through a tunnel or something. Anyway, you're listening to Ask the Doctors. If you got a question, give us a call at 813-282-8283. That is 813-282-8283. Also, I'm going to give you the phone number for Fortifeye Vitamins. We do have people, operators answering the phones. If they don't answer, call back, okay? Because we get pretty busy. It's 866-503-9746. And you can leave a message. Somebody will get back with you, but it might not be until Monday. 866-503-9746. Remember, if you're listening in the Tampa Bay area, we do have the Fortifeye Nutrition Center right there in Clearwater on McMullen Booth Road. It's right in the Bayside Bridge Plaza next to Publix. And we're open today until 3 o'clock. That's Fortifeye Nutrition Center. We've got lots of different vitamins there. We have the entire Fortifeye vitamin line. And then in Ocala, Florida, we have the Lange Nutrition Center right on State Road 200 across from the Paddock Mall. Only 2-story building on the block. Go up the elevator, first door on the right. That's the Lange Nutrition Center. All right, let's go to the phones. Let's go to Steve, who's been waiting patiently. Steve in Clearwater, good morning. Welcome to the program, my friend.
You know, in recent years, they've correlated dental, pardon me, they've correlated dental problems like peritonitis and all that stuff, periodontitis, I guess you call it, with strokes, you know. And I was wondering, could bad dental health affect the retina? Because it's so close there, it's only millimeters. And if you have an inflamed gums and inflamed tissue, only millimeters from the retina, those inflammatory factors are going to diffuse into that area, even with the brain-blood barrier. So I wondered if there's a possibility you could have a relationship between dental problems and retinal problems.
You know, absolutely. I'm not a retina specialist, but a lot of people that I've seen over the years that have had severe dental problems have also had some severe ocular problems as well, whether it's retinal or if it's anterior chamber, uveal, whether it's a retinitis or a uveitis and iritis. But inflammation anywhere in the body can affect the eye. So not just the mouth. And like you said, the mouth is much closer to the eye. But even people that have systemic problems, autoimmune diseases, here's one, for example, you know, rheumatoid arthritis, all right? And they might just have it, you know, some swollen toes and you know, knuckles, but then they can get inflammation in the eye and it can be pretty bad, you know, an iritis, uveitis, you know, a retinitis, all of this. So absolutely, dental infections and dental inflammations can lead to the eye, just about any aspect of ocular health. And we see this all the time in the practice. We used to have a dentist that worked next door, and we've taken over that space now. And we used to co-manage a lot of patients. So, Dr. Summerton, we see patients with systemic diseases affecting the eye on a daily basis, don't we?
We do, and that's why we love looking directly in the eye. That gives us that information with just a few flashes of light. We don't have to cut anything, but we can look directly at it. But like Steve mentioned, the periodontitis, anything that ends in itis means you've got inflammation of that area. And so I know there was a study with the periodontitis and retina vascular occlusions. And that's what, when we're doing the scan of the retina, we're actually looking right at all those blood vessels. We're looking at the macula, we're looking at the nerve that connects the eye to the brain, just picking up information. And we're hoping that we see everything healthy. And we also get a nice baseline because we're looking for change. So over time, we can monitor the health by just going back to that baseline picture from their initial visit.
And we love patients having the OptoMap done. The OptoMap gives us a great peripheral view of the retina and looks at the entire vascular system. We go under the retina and the choriocapillaries. And now we have some new technology that I highly recommend all diabetics have, and it's called OCTA, or OCT angiography, where we actually look at the tiny little microscopic blood vessels underneath the retina. And we're looking for inflammatory markers. We're looking for vascular problems, blocked arteries, leaky blood vessels. We're looking for hypoxic zones, areas where the capillaries are not perfusing through, and these are starved for oxygen. When irregular blood vessels will start, and that's called neovascularization, and they break down and bleed. So especially diabetics, this new technology I highly recommend on our diabetics, because the key is early detection. We can find potential vascular anomalies before the doctor can see it in your eye. We can see the potential for retinal hemorrhaging under the retina with this angiography before you actually have these hemorrhages. So this technology is cutting edge. We just invested in all this at the Lange Eye Institute. And our promise to everybody is to stay abreast of the changing times and have the highest quality eye care possible in the area.
And I have one other question. The sun cycle is 11 years. There's a 11-year sunspot cycle. And they've noticed that about 2 years after the peak, there tends to be a higher rate of skin cancers show up in dermatologist's office because there's more radiation. And the reason there's a 2-year lag is because it takes that time for the cancer to develop. My question is, if it's caused by more radiation and blue light during that 11-year sunspot cycle, then could retinal problems have an 11-year cycle where they become more prevalent?
Wow. The things that Steve asked me make me go, Once again, I don't have an answer for that. I don't know if Dr. Summerton does, but it makes sense. I mean, obviously, people that are out in the sun a lot, depending, I don't care what the cycle is, but when people that are out in the sun a lot, not wearing protective eyewear and getting sunburned a lot, they're going to be more prone to obviously basal cell, squamous cell, skin cancers, maybe melanoma, and cataracts and retinal disease, especially macular degeneration. You don't need to be afraid of the sun, but you don't want to get sunburned on a daily basis. A little sunshine is good. We talk about early morning sun, late evening sun for the red light, but the sun between 11 and 2, you just don't want to be burned. You can sit out there for 30 minutes, and after that, you probably need to cover up, because I don't really love sunscreen that much either. So, cover up. Just don't get sunburned. But Dr. Summerton, do you know anything about cyclical retinal degeneration related to this 11-year cycle?
Unfortunately, Steve, I don't know any connection. I don't even know of any study that has even looked at it. So it's definitely possible, but I'm not sure anyone's even tried to associate it with it. I think partly just a lot of people are out of rhythm in just their regular day circadian 24-hour cycle. And we know that is crucial for your health, because those kind of night shift workers that don't get on that circadian rhythm, it's a lot harder to control their diabetes. It's a lot harder to manage any chronic diseases when your whole circadian rhythm is off. So it would make sense that that could affect the health as well.
Well, the thing that puzzles me about the sun and the sunburn is why don't people get sunburns in the winter? In other words, if you look at the amount of energy, blue light energy, that hits a square meter on the Earth, in the wintertime, the air is drier. Now, granted, the sun angle's a little bit lower, but not much. And why is it that I can go out, not me so much, but people can go out at noon and have 2 hours skin exposed with the same measurable amount of blue light per square meter coming down? They're getting the same amount of blue light on their skin, and yet they don't burn in the summer. They don't burn in the winter, but they do in the summer, which leads me to believe that it might be the temperature of the skin itself that allows the blue light chemical reactions to occur, whereas if the skin is cooler, the blue light does not activate that chemistry at a lower temperature.
Well, I got proof. I was out January at Clearwater Beach, and I got pretty bad sunburn. And so maybe Florida's a little different. If you're in Alaska, you maybe have some validity to that. But Steve, we got to take some more calls, my friend.
Okay, God bless you.
All right, take care. You're listening to Ask the Doctors. I'm Dr. Michael Lange with Dr. Susan Summerton co-hosting. Steve's got me thinking off base here. Give us a call at 813-282-8283. That is 813-282-8283. Let's go to the phones. I think Margaret in Tampa has been waiting patiently. Margaret, good morning. Thanks for holding.
Hi, good morning. This is Margaret. I want to ask you, I heard you talking about Opti LIght. I would like for you to spell that for me when you get a chance, but I want to ask you other things first. What do you think about Refresh eye drops for dry eyes?
Well,
and talk about floaters.
Yeah, so I would think Refresh is, a decent over-the-counter artificial tear. I think you can use it, especially the preservative-free Refresh. I think it's fine. You can use it anytime your eyes feel sandy, gritty, burn, tear, itch. My personal preference, though, is Oasis or Optase. I like Oasis tears and Optase better than Refresh, just because it seems to last a little bit longer. But there's nothing wrong with Refresh. Opti LIght is made by a company called Lumenis Opti LIght. So it's OPTI and light, LIGHT, Opti LIght.
Okay.
It is the only FDA approved IPL for dry eye therapy. It's an amazing piece of technology. And as far as floaters go, Dr. Summerton, we see patients all day long with floaters. Some come in with an acute onset of floaters. Some have flashing lights, some don't. Some just have a big floater. I'm going to let you comment a little bit on floaters because I'm dehydrated. I have to take a beverage break here.
It is good whenever you have floaters in your eyes to get a full retina check because it's hard to differentiate if they are what we call the normal floaters or they're damaging floaters where it could actually be pieces of the retina pulling off, or it could be blood floating around in there, or it could just be a little breakdown of those collagen fibers in what we call the vitreous. That's the gel that fills your eye up. And the only way we can differentiate is we need to dilate the eyes, open that pupil that makes a little window for us to look inside. And then when we do that during the eye exam, that's what we're checking for. We're scanning the retina to make sure there isn't any holes that could tear and make sure no tears that could detach. We're looking at the blood vessels to make sure there's no bleeding there. And then we're checking the whole vitreous gel. And we do typically see a lot of little normal floaters on people. And then we also have every once in a while, and that's why when a patient calls and says, I just started new floaters, we like to get them in right away because every once in a while there are those people that have a tear. And we know once that retina starts pulling off, you've got live tissue that's against floating in the gel that we have to send you to the surgeon to put it back on the retina while it's still healthy, vibrant, and alive so that it prevents vision loss. And that's a very risky thing with floaters, is just differentiating which kind you have. But a thorough retina exam can do that.
Okay, let me ask one more. I thought about it. I have I've had the detached retina since 2012. I didn't get it fixed, and it's all the way to where they say it can't be done. Is there anything can be done for that to attach it back? Excuse me.
So unfortunately, the longer it has been, that tissue and those cells die off. So it's really difficult. We can't bring those back to life, and that's why we want to do it sooner rather than later. But usually, if it's been a long time, your body sort of goes through the healing process on its own and thickens that tissue around it to prevent it from getting worse. But once those kind of cells have died off, right now we're unable to get it back. But there's certainly a lot of studies going on with stem cells and trying to figure out how we can help people that have lost vision.
Okay. All right. Thank you.
All right, Margaret. Thanks for the call. Have a good day. All right. You're listening to Ask the Doctors. Give us a call at 813-282-8283. That's 813-282-8283. We're broadcasting from Salem Media here in Tampa Bay. If you want to set up an appointment to see Dr. Summerton or myself, Dr. Lange, or Dr. Caputi at the Lange Eye Institute in the Villages, Florida, I'm going to give you the phone number twice. It's 352-753-4014. It's 352-753-4014. Lange Eye Institute in the Villages, Florida. Just a hop, skip, and a jump from wherever you are, or a short airplane ride from where you are. All right, we're going to go back to the phones. I think it's Carolyn in Chicago, the Windy City.
Good morning.
Good morning.
Actually the suburbs. But anyway, hi, doctor. I called in with one question, and I tried to get through a long time ago on something else. But my first question, my cat was at the vet, and they think he has arthritis. Can I give him some of my omega-3 max?
Well, I give my dogs. Now, my dogs are a little bigger. My Doberman and my Golden Doodle, they get the Super Omega daily. So I think you could break it apart and just squirt some on the food, and I think that would be fine, okay?
Okay.
I don't know if they the cat needs the entire Omega Max. I don't know what the dosage would be. It wouldn't hurt the cat, all right? Because I'm sure the cat, if got a piece of fish, would eat the whole fish. So it's not going to hurt it, but I don't know if it's necessary. You could put, half of it. Start off with half, I think.
Okay, great. Okay, that's what I was wondering. Just the dosage. He's a big boy. He's 20 pounds, but I'll start with that. I'm hoping he likes it.
Amazing for their hair, for their skin, their joints, the heart, the brain, and the eyes. Amazing. So animals do benefit from the omega-3.
I'm glad to hear that. I'm going to start him on it today. Thank you for that. My other question is, and I know fish is great in that, but my favorite is tuna. But sometimes I wonder, how do I determine how much mercury is in a can of tuna, or how many cans can I have safely during a week? I could eat it every day.
I love tuna as well. So the safest fish is probably sardines. It's a non-predatory, very small fish. You can eat sardines a lot. Wild Alaskan salmon is relatively safe as well because it's not an old fish, okay? And it feeds off of the little fish that eat the algae, so they're very high in astaxanthin. That's why it has the orange color. So 2 power fishes are wild Alaskan salmon and sardines, and it's difficult to get a toxic amount of anything with either one of those fish. Tuna, you're absolutely correct. You do not want to eat tuna fish every day. I don't know the exact number. I don't know if any doctor knows the exact number, but, I've got lots of friends that are bodybuilders and they eat tuna fish, in water all the time because it's high protein, low carbs, low calories. I don't know. I mean, once a week, I think is fine. I don't think you should have any problem. Now, you could obviously have a blood test done, and Dr. Summerton, once again, is an expert in this arena. And sometimes you have to have chelation therapy if you have heavy metals that are a little bit elevated. But Dr. Summerton, she could have some testing done to see whether or not, the tuna has mercury building up in our bodies, right?
She sure can. And I personally have been through this. I have had high mercury and done the detox and ended up doing chelation myself. And when you can get tested with a urine sample, when you get chelated, and it basically pushes the mercury out, and they can measure your levels. But I'm also a big seafood fan. I could eat seafood every day too. And there's a nice little kind of God thinks of everything. When there is mercury in fish, there's also selenium. That's a mineral. And that mineral actually binds to mercury naturally. So if you're eating a fish that has a higher selenium, then the mercury toxicity risk drops with it. And so I think I'm with the tuna. There's the skipjack. I believe that has the higher selenium than the albacore. So if you are going to have the tuna, that's a better choice. And then I personally do take a mineral supplement to make sure I am getting enough selenium, and also kind of the green, like even seaweed that we tend to comes from the ocean, that helps kind of get the mercury out as well. And it's about that balance of when you're eating that seafood, making sure you've got enough of the selenium that's going to protect you from it.
Oh, wow. That's really interesting. Thank you so much.
And remember, the omega-3, our Fortifeye Super Omega and Super Omega-3 Max, has no heavy metals at all. If you look at our COA, we do a triple distillation process to eliminate virtually anything that could be potentially toxic. So you can rest assured that the omega-3 is going to be very safe. And there's more and more studies every day coming about talking about how good omega-3 is for you, especially if it's in the right molecule, the re-esterified triglyceride or triglyceride form. Remember, most omega-3 you buy over the counter has ethanol attached to the backbone. That's called an ethyl ester molecule. Very inefficient, has to pass through your liver every day to cleave it off. Well, you think about it, fish don't have ethanol in fish, so you don't want ethanol in your omega-3 fish oil. So if you stay with Fortifeye Super Omega or Super Omega Max, you're going to be fine. And there's a quick test people can do with their omega-3. If they squeeze the contents in a styrofoam cup and it rots a hole through that cup in 10 minutes, it's got the ethanol attached to the backbone, and it's the cheaper, more inferior form called the ethyl ester molecule. And yet, some people will do that and it still doesn't rot a hole through it because it's such low levels So if you have only 180 EPA and 120 DHA, that's called 1812. Even if it's an ethyl ester molecule, it's not going to rot a hole through the cup. And if it's the good form, it's going to say it on the bottle. It's going to say TG form or RTG form. So people out there, if you're looking for omega-3 fish oil, make sure it says RTG or TG or says natural triglyceride form, and you'll be fine.
I've used your products for the past about 7 years. I used to live in St. Pete. I have to come back.
Awesome.
I loved going to your Clearwater location, so it was always fun to visit.
Well, thanks for the call, Carolyn. Enjoy the Chicago weather.
Oh yeah, it's great.
And don't eat too much deep dish pan pizza.
Oh, that is good, but I stay away from that. But thanks for the info on the cat. I'm hoping to get him started today.
How old is the cat?
He'll be 12 in June.
Oh.
The reason I took him into the vet, he was licking. I noticed all of a sudden fur loss on the front leg and one back leg. So when I took him in, we thought allergies because he was in there for that last fall. But she thinks it's arthritis. So then right away they offered the monthly injection and some other stuff. And I thought, no, I'll just give him some of my omega. But right. I wanted to ask you about it. So yeah, I'll drizzle it over his food. I'm sure he'll love it.
You should be fine. I've got a lot of patients that give the omega-3 to their cats, and they do really well.
Oh, that's great. Very good. Thanks so much. Always good listening to you guys. Have a great day.
Take care. Bye-bye. All right, you're listening to Ask the Doctors. If you'd like to call Fortifeye Vitamins and order any of the supplements that we talk about, you can call Fortifeye at 866-503-9746. That's 866-503-9746. If you'd like to call the Lange Eye Institute for an appointment to see any of the doctors, it is 352-753-4014. That's 352-753-4014. Remember, we're located in the Villages, Florida, so right around the corner from Gainesville, Ocala, or Orlando. And literally, from my Clearwater house, it takes me an hour and a half to get to the doorsteps at the Villages. So it's not that bad a drive. If you live in Tampa, New Tampa, it takes you only about 50 minutes to get there. All right, so let's talk briefly about some of the things that we used to say were good for us that are not that good for us anymore. So long-term ketogenic diet, all right? There's science now. This is new science. If you're in ketosis for long-term, you can actually have premature organ aging, cellular aging to vital organs, basically. Now, nobody wants to have cellular aging to the vital organs. So that's where carbohydrates are good. If you're trying to lose weight, obviously ketosis is a good way, but you got to have some carbs. So you can be in ketosis, a good portion of the time, but you got to eat some carbs. Long-term fasting kind of goes hand in hand with ketogenic diet, hair loss. So unless you like being bald, and some people look good bald, maybe think twice about doing long-term fasts. Also, muscle atrophy from the ketogenic diet. Oh, the music's on? We only got 5 seconds. Ooh. We got to go. See you guys. Bye.